watching ABC 36 News at 12:30. Your local news source.
Welcome back. There are different treatment options for prostate cancer, and they each offer different benefits, but they also can have different side effects and complications. Well, here to tell us about a minimally invasive option that you could soon get in the U.S., we are so pleased to welcome today Dr. Stephen Woolums, a urologist with Cumberland Valley Urology. Thank you for being with us today.
Thank you. It's exciting to talk about HIFU, which is a minimally invasive treatment for prostate cancer, which is definitive, does not require a hospital stay, and has a lot lower side effect profile than the other treatments that we currently are using for prostate cancer.
Now, you've really been in the forefront of this, being one of the first doctors in Kentucky to be trained with this technology?
That's right. If you asked me 5 or 6 years ago about HIFU, I would not have been as excited about it. However, as technology has evolved and the information about HIFU has come forth, it's an excellent treatment option, and I see it as an excellent way, as a cost-effective outpatient treatment for definitive treatment for prostate cancer.
Now, kind of take us through the process. How does this treatment work for patients?
Well, it's an ablative therapy. It increases the temperature of the prostate tissue so that it kills the cancer. What is nice about this approach is it allows us to treat on the fly. We can see how the tissue is responding to the energy, and if it doesn't respond the way we like, we can retreat that area. The patient will generally have a urinary catheter for a few days, and they will go home that day.
Now, as you mentioned, we should point out this is not FDA approved here yet, but you're actually performing the procedure in some other locations.
Right. For a patient to be treated with HIFU at this point, we have to go either to Canada, to the Caribbean, to Mexico, or they can go to other countries like Japan or England.
And what are your thoughts on how soon this will be available in the U.S.?
Hopefully it'll be FDA approved in the next 1.5 to 2 years. We can't make any guarantees. It may be sooner. It'll probably come into the market as treatment for radiation failures, which there are several radiation failures. HIFU is a treatment that can be used primarily, but it can also be used to retreat cancer if you find that the initial treatment didn't kill all the cancer the first time.
And you were telling me earlier, even though some of these patients are having to travel, they're still finding it to be a cost-effective option for them?
Absolutely. If you look at the different treatment options, it is the cheapest way to treat prostate cancer that we currently have available.
Now, I'm sure there probably are some people watching right now that either are affected themselves or maybe family or friends. If they want to learn more about this option, what do you suggest they do?
The best way is to get on the internet and look up International HIFU, and my contact information will be there. Or they can contact Cumberland Valley Urology at 606-528-1172, and that's my office number, and we'll make an arrangement to talk to them either in person or over the phone.
And of course, we should point out that prostate cancer does have an effective treatment rate when it's caught early.
Absolutely. We're talking curative. We're talking 94+% cure rate if treated appropriately at the beginning.
Wonderful. Well, thank you so much for sharing that information and
Sure.
Interesting look at the options that are available. We appreciate that.
Thank you very much for having me.
Dr. Stephen Woolums again with Cumberland Valley Urology if you want to get in touch with his office or that website.